Hello and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa Hart, and on the Nurse Rosa's Insights podcast, I like to interview healthcare stakeholders, which could be any human person, about the solutions that they have seen from their lived experience that they think would make a huge transformative difference in healthcare. And joining me today is Bonnie Sloma, SVP at CareTalk. Thank you so much for being with me today.
Thank you for having me. I'm very happy to be here.
So before we got started recording, we were talking about how you have been a nurse for 42 years. So you started when you were 3, right?
Yes, 2.5.
Oh, 2.5.
2.5.
Yeah. But I would love to hear about your kind of backstory in healthcare and kind of what has informed your perspective to bring you to this point.
Sure. So it wasn't 2.5. I was actually 21, graduated from a 4-year university in Niagara Falls, New York, Niagara University.
Oh,
And I started off in a NICU. I worked at Children's Hospital in the NICU, and it was a wonderful, wonderful job. But I started to explore other areas. So I've taught education at the college level, nursing education. I then went on to be a director of nursing for long-term care, built and designed a 250-bed long-term care facility, worked
wow.
for a tech company in Fredericton, New Brunswick to develop software for long-term care. Yeah. And then I fell kind of into the dialysis world and was the quality manager and wrote CONs to build dialysis centers across New York and Rhode Island.
Wow.
So shortly after that, I went to a very large 550 bed safety net hospital. And then I went to a not for profit for almost 10 years, taking care of individuals with intellectual and developmental disabilities. And then I landed at CareTalk Health. So I've worked for profits, not for profits. I've worked in so many different areas of healthcare and nursing that I do have a really interesting perspective. Like I was telling you earlier, I
Mhm.
remember when nurses wore caps and didn't wear gloves. That's how long ago it was.
And
So
and there were dresses.
oh yes, we wore dresses and the white stockings, which at the time were very attractive to me. I thought they looked great.
Well,
So
they're very cute. I mean, that's why people want to dress up in iconic
yes,
like costumes like that. But for me, like coming in as a working in a hospital for the first time in like the 20 teens, then how are you doing CPR in these white dresses and white stockings and
yeah,
keeping your cap on? Like,
yeah.
when
Great
did that
question.
come into
Great question.
play?
Yeah, we made it through for sure. But yeah,
Okay.
you're absolutely right. You're absolutely right.
Not quite practical nowadays.
No, no,
But also the profession has evolved a lot as
a
well, right?
lot. A lot. The
So,
profession has evolved a lot. You know, I tell my kids, find something you love to do, and you'll never work a day in your life. And my son came to me, my youngest son, and said, "Are you happy, Mom? What would you do different? Tell me about your life. What would you do different?" And I
oh,
really took that question to heart, and I listened. I really thought a long time about it, and I looked at him and I go, "Absolutely nothing." I have
oh,
been blessed with the most amazing career in healthcare.
that is awesome. And so many people who have worked a long time in healthcare nowadays are like leaving the profession because they can't even imagine what it means to be a nurse if you're not working at the bedside. But
Right.
you're a great example of lots of different things. Like, so what are some of the like
Sure.
roles that you took on after being away from the bedside?
So Care Talk is a incredible organization, and we started about 3.5 years ago, and it was a small group of people, and I was brought in as the nurse, like the nurse,
Like
right?
the token
Like
nurse or
like they called me the nurse. It was great. And so I started with them, and they started to explore telehealth and
Mhm.
various types of telehealth like CCM, RPM, RTM. And I am a strong believer in that.
Yeah.
I've seen such improvements with those three things. And we started to grow and we added on a few more partners, at which time we started to realize, and I'm going to tell you, this was a revelation for me.
Mm-hmm.
People across the country that don't get the care that they need. I mean, if I could tell you story after story of people that we have helped and we have impacted who just through some of our programs.
Yeah.
We came across a program with one of our partners to do annual wellness visits. Now, annual wellness visit, part of Medicare. It's not to diagnose and treat. It's more to see how the patient is doing, what chronic diseases they have, and make sure they get all the required screenings to prevent further disease or keep them as healthy as possible, living their best life. So we started that last year. We've seen probably close to 18,000 patients across the US, and there is a huge gap.
And is this all virtual that you're talking about?
All virtual. It's all virtual. And through this process, we've realized that there are things you can push in to someone's home.
Mm-hmm.
People 65 and older, they're comfortable at home. They're not comfortable going into big organizations, driving far lengths, waiting in lines. You know, they're
Paying to park,
vulnerable. Hmm?
driving downtown to some
Yeah,
hospital, paying to park.
paying to park. It's and with the shortage of primary care providers, now I don't know if you see that where you're at, Rosa,
Yes,
but
I'm in Kentucky.
you're in Kentucky. So I see in New York the shortage of primary care providers. It's not that they're not wanting to do a good job. It's
Yeah.
just they're doing the best job that they can with the resources they have. Now we're facing a nursing shortage, right?
Mm-hmm.
So we started taking care of all of these patients and we did these annual wellness visits and we looked at their screenings. And there was so many people that haven't had their basic screenings. So we've been able to work with them and get those screenings. And it's someone said to me, I'll tell you this little piece. And they said, why do you do that? And I said, because if you talk, I have parents that are older, they're in their 80s. And my mother will call me and she'll say, I've got all this work. I don't know what all this is. What is all of this? And I'm like,
Mm-hmm.
Mom, you don't have to worry about that, but we need to make you an appointment with this and we need to do this.
Mm-hmm.
So not only do our providers see the patients and do an annual wellness visit, but the other part of it is then we help them. We find someone in their community that can provide a mammogram or a colonoscopy or some lab values, and maybe they need a statin, whatever it is they might need. And then we help them make that appointment and help them close that care gap. And it's working.
Yeah.
It is working, and we're seeing tremendous outcomes. And as part of Care Talk, the other side of that is we will call a patient for an appointment in our virtual clinic, and we'll get a blood pressure with a face scan. And the blood pressure will be, we just had a gentleman, 247 over 137 blood
What are
pressure.
you saying now? A blood pressure with a face scan? How
Yep,
long
it
do you
scans
take?
your face. It scans your face and gives you a blood pressure. Yep.
Now, how
And so
accurate
then
is
he
that?
had a cuff in the house. So we said, well, can you get your cuff and let's
Verify that. Yeah.
yeah. So he went back.
247 and you're not actively stroking out right now?
Yeah. So his wife was terminally ill. He hadn't been to
Oh,
the doctors himself because of financial resources. So think about those SDOHs, right?
for sure.
And so we got another blood pressure and it was the same. So we
What?
told him he had to go to the hospital. And he did go to the hospital. He ended up in ICU.
Oh,
And those are the kinds of people we're touching.
yeah.
Those are the kinds of people, one by one, that we're helping. We have called 911 multiple times.
Yeah.
The other thing about it that I never realized, I've always known, especially where I live in Buffalo, New York. So when the winter comes, people get depressed because there's no sunshine and that kind of thing. But we have a problem nationally with depression and anxiety, and our seniors, they're so lonely. They don't have
Yeah,
family
very
members.
isolated.
We get a nurse on the phone with them, they'll talk for 20 minutes.
Mhm.
And,
Yeah.
multiple times they say, no one cares. And I said, we care.
Mhm.
And we're going to help you work through all those things. And CareTalk Health does.
That is
We work
amazing.
through them. Yeah, we're
Now,
very proud of
and
what
I
we
could
built.
dig into that really for a while
Sure.
because that is similar to my day job. But
Yeah.
I want to revisit while we're talking about the annual wellness
Yeah.
exams. Like, what about like auscultating the heart and lung sounds? How does that
So,
come into
so
play?
right now, Medicare does not require a physical exam as part of the annual wellness visit.
Hmm.
Okay.
Does it require the lab draws and things like that for
So it
CDC?
goes to the screening. So if you have a patient who may need a lab value or a test, Medicare puts out all the different recommendations for screening, and it updates every year with ages and time
Oh,
frames. So we will look at what they've had done, and then we'll address the things that they haven't had done.
mhm.
So we make a lot of referrals for behavioral health, mental health
Mm.
in their community to help them. Um, I would say that I've called adult protection at least a dozen times
Oh, wow.
in the last couple of months, because some of these folks, and this breaks my heart. This
Mhm.
breaks my heart. A gentleman who was living in the woods in Florida, a couple in Washington state in the winter living in a neighbor's barn because they had no financial resources or
Yeah.
very limited, and they had to pick and choose. Do they take their meds? Do they eat? Or do they stay in their apartment? That is far more rampant than I ever imagined. And I think
Yeah.
that validates for us at CareTalk Health exactly what we're doing and why we're doing it, because we are making a difference nationally. Think
Yeah.
about that.
Well, how are you even getting in touch with these people who are so remote anyway?
So, one of our partners will send to us information about patients who they haven't seen a provider in at least a year. And they're over 65 and they haven't had an annual wellness visit. And then we take it from there.
Oh,
We
okay.
get them on the phone, we get them on video. They talk with a nurse for about 20 minutes and go through a variety of things. And then we get them over to our provider who will then talk with them. And we care. I mean, it's, you hear that old adage, when I first started nursing, everyone say, well, what's your strength? And I said, I care. But I really do. And so does everyone I work with. Care Talk Health's culture is we do everything we can because we care about the patients.
Yeah.
And our providers, nurses, our PSSs, and especially our leadership. And that is the culture that we have built.
That is just beautiful. And I mean, I really appreciate helping people like navigate the system. Like I've done
Mhm.
a lot of like stroke follow-ups and they need so much help with just really basic things of like making appointments because it's like climbing through a spider's web. It's,
Yes.
it's like which thing am I supposed to pull on to make this work?
Right. You
And
are
so
absolutely
many
right.
so many times you'll call one number and they'll be like, no, the wrong number. And then you're like, well, now what? Right.
Yeah. Yeah.
And so hearing that you provide that all of those levels of support is
Yes.
really surprising. And you guys have been operational in this how long?
3.5 years.
Okay.
So we have a lot of patients, and the patients that are coming to us now, about 50% do not have primary care providers.
Yeah.
So we're helping to find them providers in where they live. Um,
Oh,
even
okay.
if
So you're not filling that primary care role for them on an
No,
ongoing
no.
basis. It's just that initial.
Yes, ma'am. Yeah. Yeah.
Oh, okay.
So we get them, we talk to them, we meet them where they're at. And we
Hmm.
say that all the time, we're going to meet the patient where they're at. And
Oh,
sometimes patients take a long time. We spend a lot of time. I've seen calls with nurses go 45 minutes
oh, for sure.
because we really want to understand where they're at, because we want to make sure that we do everything we can for them.
Yeah, definitely. And identify all of their needs, right? There are so many like standard screenings that
Mhm.
exist that
Oh,
really just don't take into consideration all of the different social determinants or I think I heard somebody the other day in population health say social drivers of health,
mhm.
because if you're not able to afford your food and your place that you live and your medications and
Yep,
everything, and then you get labeled non-compliant, how is that helping?
it's
Labeling
not
people
helping.
non-compliant when they can't afford to live isn't
Mhm.
helping anybody. Like,
It is not, and I've heard that term used a lot. Well, we're going to DC, discharge him from our practice because he's non-compliant.
well,
You have to explore that with that patient. You have to,
exactly. Did they even know about the appointment, or was it made automatically in some EHR and they never found out about it
right, right,
because nobody ever called them, or they called an old number, or
yep,
they sent a letter to an old address, and then
right.
you're going to hold
And then
that
they stop, and then
patient's.
they stop, and there's not that extra effort. We go that extra effort to get a hold of the patients.
Mm-hmm.
Um, it's really exciting to see what CareTalk Health does every day for those patients.
Yeah, I'm
Um,
so excited to hear that this is happening in the world.
it is,
It
and
it fills me with hope.
you said something like, "Oh, you're not their primary care." Primary care providers. There's not enough of them nationally.
Right?
You would agree, and there's a nursing shortage. So healthcare can't be made up the same way it's always been made up. There
Exactly.
has to be different facets that are in, it's too fragmented right now. So
Mhm.
utilizing virtual care like Care Talk Health for annual wellness visits, CCM, RPM, RTM, those
Now,
are,
RPM is remote patient
yes,
monitoring,
ma'am,
right?
yes.
What is CCM to you?
So CCM to me is a patient who has two or more chronic diseases
Okay.
that need help reaching their own goals. I really believe that this isn't something that someone does in isolation. We have nurses, our registered nurses meet with our patients and they find out, how are you doing? Are you able to do this? What are your goals? Patient centric
Mm,
goals. And then we work to help them meet those goals. And not every patient is the same,
right.
right? So we and I do think that RPM is great. Like, right now we may have a patient who's going to be he's hypertensive, and we're going to start him on a first line hypertensive medication. That patient being on RPM and monitoring that blood pressure in real time every day
Mhm.
makes all the difference when you start to see subtle changes in care. So
Exactly. Then you can actually start getting into the prevention zone and not just the
yes,
management zone.
yes,
Because to your point, like I know I've counseled a lot of patients, to take their blood pressure every day at home because your primary care may have started you on this blood pressure medicine, but we need to see if it's getting you to that goal range at home or if it's taking it too low. And once I explained to them that we actually don't want you to be on this if it's taking your blood pressure too
too
low,
low,
we're just trying
right?
to get to that sweet spot for
Yep.
prevention.
Yeah, absolutely, Rosa. And, a lot of times patients who are older will start it and something happens, they don't like it, they don't feel right, but they
Yeah,
don't tell anybody. And
yeah.
then you check back in, they go back to the doctors in 4 weeks, and then it will get addressed. For us, if we have a patient, we can not only monitor them in real time, we can titrate or change medications in real time and
Oh,
get them with a provider. So it's very quick, it's very real time, which makes a
excellent.
huge difference in our health outcomes.
Definitely. Especially like if they're on a beta blocker and then they just like drop off of it and then they have rebound hypertension and get into crisis mode. That's
Yes.
a whole new ball of wax, right?
Yep.
So
Absolutely.
I'm really excited to hear that you're empowered to do that. So I guess you have a physician or a nurse practitioner who's able to
Um, we
adjust the
have we
prescriptions.
have many physicians and nurse practitioners. Over, I would say, actively working right now, over 100.
Nice.
And we have about the same amount of nurses, and we are a national physician practice,
Awesome. All 50 states?
all 50 states and DC. Yep.
Nice. In DC.
So,
Oh.
and DC, can't forget DC. You'd be surprised. You would get patients from DC.
Well, no, I am not surprised. I mean, the lack of access to care is everywhere. It's not
It's
about how many
everywhere.
traffic lights they have. It's
Mhm.
about the humans who can tolerate working in healthcare.
Absolutely. And, we if primary care doctor says, well, you don't need virtual care, I'm your primary care provider, the way we see ourselves is we're just another cog in that healthcare wheel, because what we can do is when we identify things, we wrap it all up and we send it back to the primary and say, look, this is what we found, this is what we did, and then they can provide the continuity of care. So our intent is to not take patients. Our intent is to get to those patients that haven't been to the doctors or
Mhm.
responded to the doctors. I'm not saying anything poorly about primary care, but we both know
Mhm.
that primary care doctors in this country have it very hard right now. Very
Yes,
hard.
they really do. And anything we can do to alleviate
To
their burden.
assist them, yes.
Yeah,
Yes, absolutely. So we do everything we can to help do that.
that is amazing. Well, I need to ask you the signature question that I ask everyone on the Nurse Rosa's Insights podcast, which
Yes.
is, if you were given a grant, Bonnie, for $1 billion
Mhm.
to meet a need that you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
So I thought about a lot about this because I've always thought that our healthcare system in the 42 years I've spent in it is too reactive to diseases and reactive, and we're constantly reacting. So preventative care was the first thing I started with, but then I started thinking more for deeper.
Mhm.
And I don't know if this is a term, but I thought about clinical prejudice. So let me tell you what that means to me,
Please tell me.
that anyone, regardless of socioeconomic class, regardless of where they live, regardless of insurance, regardless of anything, gets the same level of care nationally, because they don't. And I've experienced it multiple times in my career. And I really believe that if we could get the policymakers to look at healthcare differently, then we could achieve that. Um, it's upsetting to me. So I've worked in some of those, areas where people don't get the same level of care, and I went to workplaces to change that personally
Yeah,
because it
exactly.
bothered me so much. So yes, we need preventative care, but we have to find a way to get care to everyone, the same level of care. And honestly, CareTalk Health, we're doing that. We're doing that now. Doesn't matter where they live, doesn't matter if they're 2 hours away. Our nurses work to get services pushed into the home so they don't have to leave. We work to get them financial resources and community resources. So we work really hard at doing that, but we're just one group, right?
Mhm.
We're one group, but one patient at a time.
Exactly. And when you make a big difference in one patient's life, that's their whole world that
It
you've
is.
impacted.
It truly is. Well said. Well said.
Well, I gotta hold on to that, because every now and then, you want to save the world, and then you're looking
Right.
around, and I'm like, but I can only help this handful of people today.
That's right.
But to those each individual person, it changed their whole world,
Yes.
because you're giving them hope, you're giving them education and access to things they never would otherwise. And so that really just can't be discounted.
No.
People want
It-
to see big numbers. Well, how about the percentage per person?
yeah. 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 Right. Right.
You got to start
So,
somewhere. But I totally am tracking with you. I mean, so in Kentucky, my area of expertise is in stroke, and I do a lot of advocacy, policy advocacy, as well as, just trying to build new systems and improve communication through bringing stakeholders together. And um, unfortunately, in the state of Kentucky, because we have such rural populations, if you have a stroke in the state of Kentucky, you're more likely to die of it than in the surrounding states.
wow.
And so this is not something I am taking lightly, what you're talking about whatsoever.
Mhm.
Like, that's something that I see a need for every day. And
Yes.
so thank you for
Thank
providing
you.
that service.
Yeah, we are very proud of it, and our patients are very happy. So yes, it's been an adventure. I didn't know what it was going to be when we started, but wow, the impact is incredible.
And what policies could be started or changed that would uh, equalize the services and make it more
Yeah.
accessible?
So having family members who are on Medicaid and having a husband who's on Medicare, and then having friends that live in very rural areas with
Mhm.
limited services. The only way we can do it is to change the reimbursement structure in our country. You know, we have our commercial insurance and our private insurance, and then we have Medicaid, then we have Medicare,
Mhm.
and some people just can't afford the
Mhm.
level of care. I had an experience with my son. It doesn't matter where it was, but I had
Mhm.
an experience with my son that we got to his appointment. He was a trauma patient. We got
Mhm.
to his appointment at 8:30 in the morning, and I took a ticket, like a meat market ticket.
Oh.
And I went, "Oh, okay." So I sat down. So I'm waiting an hour and they're calling people. So I go up and I said, "Excuse me, we have an appointment at 8:30." And she said to me, "Oh, everybody's appointment is 8:30." The long and the short of it is we didn't get back till 2:30. And when I said to the provider, I had an appointment at 8:30 and it's 2:30. He looked at my chart and he said, my son's chart, not my chart. He looked at my son's chart and he goes, "You're not supposed to be here. You should be in our private clinic. You have commercial insurance." Okay. So do you know what I did? I applied for every single job at that facility. And till I could get in there and I fixed that place. I
Are you
literally,
serious?
yes,
Bonnie,
it
I love
bothered me
you so
so much.
much.
It bothered me so
This is
much. Like,
amazing.
because people are uninsured or underinsured, shouldn't have to be sitting from 8:30 in the morning and take a meat market ticket. It's wrong. It's
Right.
wrong. And, so I really truly did go into healthcare to take care of people. And that's the beauty of CareTalk Health is we have a small but mighty team with all of us having the exact same vision, and we are committed to taking care of people. And so it's really exciting. But yes, that's who I am. That's who I am.
That is amazing. And I love it that you are just fully like embodying your vision, or what is that called? You're integrated. Is that what that's
Integrated.
called? Yeah.
Yes. Yeah.
With your purpose.
Yes. Oh, I absolutely
Love
am.
that.
This is why I'm here, for sure, for sure. And it may be, 100 patients, it may be 10,000, but through leadership, my clinical leadership at CareTalk
Mhm.
Health, I know that we are impacting thousands.
Oh my gosh.
I
This is
know,
so
right?
cool.
I know it's fantastic. Who knew? Who knew I'd ever have this wonderful opportunity? And I do feel like it's a wonderful opportunity.
Well, and I love your chutzpah to just get in there and you're like, well, I'm just going to get some job and I'm just going to fix
I
this.
did. I applied for 4 jobs and the CEO ended up walking in and said, "Well, they're all fighting over you." And I said,
Oh,
and then
that's
he goes, "So what do you want to do?" And I said, "This is what I want to do." So that's what I ended up doing.
That's
Yeah.
awesome because
Yeah.
you just need some outside perspective.
Yeah, for
Let's make
sure.
a new plan here.
Well, I think society has to view it differently. I
Yeah,
do. I
it
really do.
does.
But reimbursement doesn't, like, reimbursement is reimbursement, right? So if providers are getting Medicaid rates, which don't pay for the visit, or people who have no insurance, then they have to supplement that with people that has insurance. But that doesn't mean they have to be cared for in two separate places
No.
and give them a meat market ticket to be there at 8:30 in the morning, right? And I mean,
I relate to
I,
that so hard. Yes. Because when
yes.
I had my firstborn, I was a young college student and we
Mhm.
were on WIC and getting the
Mhm.
food vouchers and everything. And in order to do that, you had to have your wellness visit in order to get your vouchers for the milk and formula and everything else, right?
Yep, yep, it's a
And
lot.
I had to block off a whole day to sit in the it wasn't specifically the health department. It was a specific like WIC clinic.
Mhm. Yep,
Um, and I would get there at 8 o'clock in the morning and be sitting there until noon because they would double book every appointment because a lot of people would no show. And I
right,
was like,
right.
why am I being punished for other people no showing? So that was when you were describing that, that felt personal to me. So
Yeah,
I
it's
really
yeah.
appreciate
I
you fixing that.
it's crazy. So, you try to let it be known like how it should be, and then you just hope that the policymakers and the folks fall in line with that. And we were really successful. It was well received, very well. In fact, we built a whole new clinic, so it was
That's
good.
incredible. Well,
Yeah.
and when you can bring the stories of how this really impacts people's lives, I mean, that's what resonates with people, like numbers and percentages and data. Like if it's numbers and money, I guess that speaks.
Yeah,
But
yeah, money is money. Look, it's a business. No matter how much we want to admit it, it is a business. And I understand that. The numbers have to be okay to be able to take care of people. And I understand the challenge of, primary care providers and, all different specialties. Because I had about 40 clinics.
mm,
But the bottom line is that if policy doesn't change, and we don't at the very highest level look at reimbursements for everyone,
mhm,
right? Then there's always going to be these disparities.
yeah,
So, I really think that, when I think about telehealth, I think about it changing healthcare for everyone,
right.
because they can do it from their home, they can do it from their phone. And you know, Seniors that are 65 and older, they're proud. They, you know what I mean? They're
Mhm,
proud, but yet they're vulnerable. So having the ability to talk with them and get to know them is our privilege. It's a privilege for us. These are amazing people.
yeah,
And you know what I think about back in nursing school? When you were in nursing school, where was your first clinical?
I believe it was that in a nursing home?
Yep.
Yes.
So don't you scratch your head? Don't you scratch your head and say, these are our most vulnerable, complex medically patients, and we put brand new nurses in the nursing home? It baffles my mind.
I
You
mean,
know,
you got to put them somewhere,
I
right?
know, I know,
These
and
days, you're lucky to get any kind of nursing
I
student
know, I
placement.
know, and we do need nurses. The next few years are going to be really challenging, and that's why we got to be creative. The
Mhm.
folks in healthcare, the leaders in healthcare, have to come together and be creative of how we can impact care. And I am particularly sensitive to our elderly population.
Oh, for sure. And there's
Yeah,
so many of them now.
there really is. There really is.
So
So,
anything we
and
can
I'm
do to
pretty
get
close
around,
myself. So,
well, you keep wearing that pink and we won't be able to tell.
well, thank you. Thank you, Rosa. You're
Well,
lovely.
Bonnie, this has been an absolute delight and an honor to get to know you
So
and to
nice to
learn
meet
about your
you.
work. So, if people want to connect with you, get to know you better, or maybe invite you to speak, I don't know, and learn
Well,
from you, is LinkedIn the best way for them to find you?
it absolutely is. So I appreciate that. I really appreciate you having me here today.
definitely. And I'll drop your LinkedIn in the comment or in the show notes below. And let's see, is the website if they want to learn more about CareTalk and the model
Yep.
and how that works?
CareTalkHealth.com, and you'll
Mhm.
see all the different things we do. We like to partner with other folks. We don't look at it as like a vendor relationship. We partner with them. So whatever help that they may need, we if we don't have it, we've built it.
Yeah.
So we have built out many different ways to care for people virtually.
Is the term for that scrappy? Is that what would you describe your approach?
I don't know.
I don't know.
I
Okay.
don't know. I think that the team that we have so often, and this is one of the things that I'm truly grateful for with CareTalk Health. So often, as a clinical leader, there will be something that just doesn't. I don't like it. Like it
Mhm.
would be so much better if we could do this.
Yeah.
And I've only got a table full of people, and when I throw that out there, they'll say, "Oh, we can do that." So it's not like a
Well,
lot
they
of red
catch the
tape.
vision and they build with
Yes.
you.
And they have the vision. We all have the vision. In fact, when we all get in a room, we talk about all the things that we can do and what should we do and what are the priorities and how can we meet the needs of people nationally.
That's
And so it's an amazing organization, patient centric, amazing culture, great nurses, great providers, and we have great patient support staff. So we really do have an amazing organization. And our owner is at the top. He's the one leading us, and our COO and our EVP. They are amazing people to work with, and I just can't say enough about them. It's been the best adventure of my career.
wow. And you've
It
had a
is the
few.
way I'm going to end my career. Yes.
That's fantastic. Well, with integrated with your purpose, as you should.
It is,
Hmm.
absolutely. So if you
That's
want to
great.
come work, do telehealth. You just give me a call.
There
I'd
you go.
love to, I'd love to have you. I'm always recruiting nurses, so
Oh, perfect. Well, and then for our listeners, if you've enjoyed this episode of the Nurse Rose's Insights podcast, please feel free to like and subscribe wherever you're listening, or if you're watching on YouTube, then you can see our bright colors and how happy we are to be together.
yes.
And please make sure you follow me on social media. It's at Nurse Rosa Speaks on your favorite platform. And I'll have links in the show notes below. So check that out, and I'll see you in the next episode.
Thank